Good morning. I am Dr. Pramod Bhor, Director of Orthopedics, Fortis Hospital, Vashi. Today we are going to speak about Carpal Tunnel Syndrome. So what is Carpal Tunnel Syndrome? Carpal Tunnel में ये होता है कि जो first 3 fingers हैं हाथ की, ये और ये, तो इनमें numbness शुरू हो जाता है. There are numbness in these 2 fingers. Plus there is pain in the wrist. So Carpal Tunnel में होता ये है कि जो नर्व है जो ये 2 फिंगर्स को सप्लाई करती है उसको प्रेशर उसमें कंप्रेशन आ जाता है. सो द नर्व पासेस फ्रॉम द wrist एट अराउंड द wrist लेवल फ्रॉम द एंटीरियर साइड. सो जहाँ पर से जो कार्पल कैनाल रहता है वहाँ से वो कार्पल टनल में से जो पास होती है तो वहाँ पर नर्व पे कंप्रेशन आ जाता है एंड दैट कॉजेस कंप्रेशन ऑन द नर्व विच कॉजेस नमनेस, बर्निंग पेन समटाइम, और अगर कंप्रेशन ज़्यादा दिन रहे so it causes even motor symptoms as in power loss of the fingers. You can see a pointing index sign that is seen. Now ये होता क्यों है? Why does carpal tunnel syndrome happen? So carpal tunnel syndrome can happen because of sometimes physiologically also. It's very commonly seen in post-pregnant females. This during pregnancy and lactation because of the increased inflammatory reaction or because of the hormonal imbalances. But these reduces on their own, but pathologically it is seen in patients with diabetes, with rheumatoid arthritis, with even who have mild amount of arthritis in the near the carpal bones. So जब भी carpal जो है flexor carpal tunnel के ऊपर एक flexor शीत रहता है जिसमें वो जो space है carpal tunnel is a confined space, it's a small space. Wherever there is increased inflammation in the space, the nerve gets compressed. So the treatment, whenever there is increased inflammation can be in diabetes, it can be in rheumatoid, it can be in many other conditions where thyroid functions are deranged, and all these are deranged. So while starting for the treatment of carpal tunnel, we have to rule out all these causes. क्यों हुआ है? We have to find out why it is happening. We have to treat these conditions. How do we confirm कि ये carpal tunnel syndrome में clinically हम patients को examine करते हैं कि ये patient को यहाँ पर ही compression है या it is originating from the cervical spine. Sometimes even cervical pain can mimic the similar symptoms. So हम try करते हैं कि उसको find out करें कि ये यहाँ से है. The diagnostic test for carpal tunnel is to get an EMG NCV जिसमें नर्व कंडक्शन वेलोसिटी हो जाता है एंड दैट इज अ कंफर्मेटरी टेस्ट कि ये नर्व यहाँ पर कंप्रेस हुआ है, wrist पे कंप्रेस हुआ है. ट्रीटमेंट में नंबर 1 इज रेस्ट, ट्रीटिंग द अंडरलाइंग कॉज दैट इज रूमेटॉइड, यूरिक गाउट और थायराइड, शुगर एंड ऑल द अदर कॉजेज, गिविंग इनफ रेस्ट टू द wrist so that the inflammation around the wrist settles down. ये एक बार सेटल हो जाता है then it is well and good, the symptoms settle down, the numbness starts subsiding and the pain goes away. If it is not subsiding, the final treatment can be carpal tunnel release, where we have to release the nerve around it's a small surgery where but it's a specialized surgery where we release the nerve. We see that the nerve is completely free along the path supplying the muscle. Though it is a day procedure, morning में करके patient goes back home on a day. It is the final procedure for any treatment for carpal tunnel. Thank you.